After the age of 60, our bodies change in ways that can surprise even the best doctors. And here's a hidden truth. While some medical checkups could save your life, others may do more harm than good. Did you know that up to 30% of medical tests in seniors lead to unnecessary treatments, side effects, and even hospital stays? The challenge isn't just about getting more tests. It's about getting the right ones. The right test can save you. The wrong ones can harm you. That's why today on Senior Health Master 247, we're going to walk through 3 checkups every senior over 60 should keep on their radar, and 3 checkups you may want to avoid because the risks outweigh the benefits. By the end of this video, you'll know exactly which tests help you live longer, stronger, and with more peace of mind, and which ones could quietly drain your health and energy. Now, before we dive in, let me make something very clear. This video is for educational purposes only. I'm not here to replace your doctor. Every person is unique, and you should always talk to your healthcare provider before making changes to your medical routine. What I'll share with you today is based on research, clinical studies, and decades of medical practice with seniors like you. Think of this as a guide, a flashlight in the dark corners of modern medicine. We'll start with the 3 checkups you should do. These are the ones that bring real protection, early detection, and the kind of insight that makes all the difference as we age. Then we'll shift gears and reveal the 3 checkups you may want to avoid. Tests that sound useful but often lead to unnecessary stress, cost, and complications. Stay with me until the end because I'll also give you a simple checklist of red flag symptoms that truly do require medical testing. And I'll recap everything in plain English so you can walk away with confidence, not confusion. Before we start, let me ask you, how often do you go for medical checkups? Once a year? Twice? Or maybe only when you feel something's wrong? Drop your answer in the comments below. I'd love to know how you approach your health after 60. All right, let's get into it. First up, the 3 healthy checkups you should absolutely keep after 60. These are not optional. They're your allies for healthy aging. And the very first one might surprise you because it has nothing to do with pills or scans, but everything to do with protecting the most important muscle in your body. Number 1, heart health check, blood pressure, and cholesterol. Your heart is the engine that keeps everything running. After 60, keeping an eye on your cardiovascular health isn't just smart, it's essential. High blood pressure and high cholesterol often have no symptoms. You can feel fine, walk around, enjoy your life, and yet silently plaque is building up in your arteries. That's why they call it the silent killer. According to the American Heart Association, nearly 70% of adults over 60 have high blood pressure, and about half don't even know it. The good news? A simple blood pressure cuff and a cholesterol test once a year can give you an early warning before disaster strikes. Take Bill, a 64-year-old retired truck driver. He thought he was healthy, never smoked, stayed active. At a routine checkup, his doctor found his blood pressure was 160/95, way above safe levels. Bill didn't feel a thing. But because it was caught on early, lifestyle changes plus a small dose of medication helped him bring it down. Today, at 68, he's still traveling with his wife instead of recovering from a stroke. Regular monitoring combined with small lifestyle adjustments like walking 30 minutes a day, reducing salt, and getting quality sleep can reduce heart attack and stroke risk by up to 50%. So if there's one checkup to put at the top of your list after 60, it's your heart health, because nothing else matters if your engine fails. But the heart isn't the only system that silently changes as we age. There's another part of your body that begins to fade without warning: your eyes. Number 2, vision and eye health check. They say the eyes are the window to the soul. After 60, they're also the window to your independence. Vision problems like cataracts, glaucoma, and macular degeneration become much more common after 60. And here's the catch. Most of these start silently. You don't notice until your vision is already compromised. The CDC reports that 1 in 3 seniors over 65 has some form of vision-reducing eye disease. Poor vision is not just about reading the newspaper. It directly increases the risk of falls, fractures, and even depression. Consider Maria, age 72. She loved gardening, but one day she tripped on a garden hose and broke her wrist. Later, an eye exam revealed advanced glaucoma. With regular eye checkups earlier, her loss of vision could have been slowed, maybe even prevented. Eye exams every 1 to 2 years after 60 can catch problems early. Cataracts can be corrected with surgery. Glaucoma can be managed with drops or laser treatment. And age-related macular degeneration? Caught early, supplements like vitamin C, E, zinc, and lutein can help slow its progress. Your vision isn't just about seeing clearly, it's about living safely and independently. Now, we've talked about your heart and your eyes, but there's one more area that quietly controls your balance, your strength, and even how well you bounce back from illness, and that's your bones. Number 3, bone health and fall risk check. Strong bones mean freedom. Weak bones mean limitations. After 60, keeping your skeleton in check can literally keep you standing. As we age, bone density naturally declines. For women, the drop is faster after menopause. For men, it's slower but still real. The danger isn't just osteoporosis, it's the cascade of events after a fracture. One hip fracture can turn an active senior into someone who needs lifelong care. 1 out of every 3 women and 1 out of every 5 men over 65 will suffer a fracture due to weak bones. And half of those who break a hip never fully regain their independence. Think about James, 67. He was walking down icy steps, slipped, and broke his hip. He had no idea his bones were so fragile. If he had known earlier, simple steps like strength training, vitamin D, and balance exercises might have made all the difference. A bone density scan, DEXA, every few years after 60 can help guide you. But here's the key. It's not just about pills. Research shows that resistance training twice a week can increase bone strength and reduce falls. Add in vitamin D, calcium-rich foods, and even simple practices like Tai Chi to improve balance. Bones may be silent, but when they break, they speak louder than anything else. Protect them before it's too late. So there you have it, the 3 checkups you should do after 60, heart health, eye health, and bone health. Together they cover your engine, your vision, and your foundation. But remember, I promised you balance. For every test worth doing, there are others you may want to avoid. Up next, we'll uncover 3 checkups that often do more harm than good after 60. And number 1 might shock you because it's something many people ask for every year, thinking it's the ultimate safety net. Number 1, annual whole-body CT scans. It sounds like the ultimate peace of mind. Get a scan of your entire body every year and catch everything early. But here's the problem. Whole-body CT scans are more likely to cause harm than save lives. A CT scan exposes you to radiation, much more than a simple X-ray. When you scan your entire body without symptoms, you're exposing yourself to unnecessary radiation and, even worse, unnecessary worry. One whole-body CT scan can deliver the equivalent of hundreds of chest X-rays worth of radiation. Over time, repeated scans raise your cancer risk, and studies show that in people with no symptoms, most of what these scans find are harmless nodules, things that look scary but don't need treatment. Take Marcus, 70, who insisted on an annual CT just to be safe. One scan found a small spot on his lung. It turned out to be nothing, but before he knew that, he went through a biopsy, suffered a collapsed lung, and spent a week in the hospital, all from a harmless spot that would never have hurt him. The better approach? If you have symptoms, like sudden chest pain, unexplained weight loss, or coughing up blood, then a targeted CT can save your life. But annual whole body scans without symptoms, best to avoid. Radiation isn't a safety net, it's a risk. Only scan when you need to. And while CT scans might expose you to radiation, there's another test that often leads to unnecessary procedures in seniors, one you might not expect. Number 2, routine cardiac stress tests without symptoms. Heart health is vital, yes, but stress tests for the heart, especially in seniors without symptoms, are often misleading and even dangerous. A stress test is when you walk on a treadmill while hooked up to monitors to see how your heart responds. Sounds smart, right? The issue is, after 60, the rate of false alarms goes way up. Studies show up to 40% of stress tests in older adults suggest problems that aren't really there. And when that happens, it triggers a cascade of extra tests, angiograms, stents, and sometimes even open heart surgery. And here's the kicker. For people without chest pain or symptoms, these procedures don't improve lifespan or quality of life. Raymond, 66, felt fine. His doctor recommended a routine stress test, which came back abnormal. One thing led to another: angiogram, stent placement, months of recovery. Later, specialists told him the blockage wasn't life-threatening at all. Raymond went through surgery, pain, and expense, all for nothing. If you have symptoms like chest pain with exertion, sudden shortness of breath, or fainting, a stress test can be life-saving. But as a routine annual test for seniors who feel fine, it's more trouble than it's worth. Instead, stick to regular blood pressure and cholesterol checks, and talk to your doctor about simpler tools like an EKG or coronary calcium score if needed. Don't test the engine when it's not sputtering. Stress tests should be symptom-driven, not routine. Now, the last test we'll talk about is one many people consider a gold standard of prevention. But after a certain age, it may actually bring more risk than reward. Number 3, routine colonoscopy. After 70, colonoscopy saves lives, no doubt about it. But after age 70, the balance begins to shift, and the risks often outweigh the benefits. A colonoscopy involves sedatives, bowel prep, and the procedure itself, all of which are harder on the body as we age. The older you get, the greater the risks: bleeding, perforation, and complications from anesthesia. The U.S. Preventive Services Task Force now recommends colon cancer screening up to age 75 for most people. Beyond that, the benefit of catching new cancers goes down, while the risks of complications go up. For seniors over 80, serious complications can occur in up to 20 out of every 1,000 procedures, a much higher rate than in younger adults. Dana, 77, went for her routine colonoscopy. During the prep, she became dehydrated, fainted, and ended up in the hospital with kidney injury. The colonoscopy itself found nothing abnormal. The procedure meant to protect her ended up harming her. If you have a strong family history or symptoms like blood in your stool or sudden changes in bowel habits, a colonoscopy after 75 might still make sense. But for routine screening, consider simpler, safer tests like a fecal immunochemical test, FIT, done at home once a year. After 75, protect your colon the smart way. Less invasive tests, more peace of mind. So there you have it, the 3 tests to think twice about after 60: annual whole-body CT scans, routine stress tests without symptoms, and routine colonoscopies after 75. But remember, it's not about avoiding all tests. It's about choosing wisely. Up next, we'll go over a simple checklist of red flag symptoms, the moments when you should absolutely get tested right away. Now, you might be wondering, if I'm not supposed to run for every test, then when should I go? That's a great question. And here's a simple rule: always pay attention to the red flags. If you notice any of these, don't wait, don't Google it, Talk to your doctor right away. 1. Chest pain with exertion or at rest. 2. Sudden shortness of breath or fainting. 3. Blood in your stool or black tarry stools. 4. Unexplained weight loss of more than 10 pounds in a few months. 5. Persistent coughing up blood. 6. Sudden severe headaches or new neurological changes. 7. Loss of vision or sudden vision changes. 8. Frequent falls or loss of balance. These are the moments when testing can truly save your life, so it's not about avoiding medicine, it's about using it wisely. Let's pull it all together. Here are the 3 checkups you should do after 60. 1. Heart health checks, blood pressure and cholesterol. 2. Eye health exams to protect your vision and independence. 3. Bone health and fall risk checks to keep your foundation strong. And here are the 3 checkups to avoid after 60. 1. Annual whole-body CT scans without symptoms. 2. Routine cardiac stress tests without symptoms. 3. Routine colonoscopies after 75 unless you have risk factors or symptoms. It's not about more medicine. It's about smarter medicine. It's not about fearing disease. It's about building strength, confidence, and clarity as you age. Because the truth is, less can be more when it comes to medical testing. Now I'd love to hear from you. Which of these checkups surprised you the most? Do you think you've had too many tests or maybe not enough? Share your experience in the comments below. I read every single one, and I'll do my best to reply personally. If you found this helpful, hit that like button. It really helps more seniors find this information. And don't forget to subscribe to Senior Health Master 247 for more clear, science-based, and empowering tips for healthy aging. We're here to help you not just add years to your life, but life to your years. Stay strong, stay curious, and stay connected, because health isn't just about surviving, it's about thriving and enjoying the beautiful life ahead with your loved ones. Until next time, this is Senior Health Master 247, wishing you good health and peace of mind. Your health, your choice, your strength.